Hi folks, this is Dragon. A little bit on field hygiene and first aid in the field. What you can see in front of you there is my right index finger. I had a small cut across the joint, a crease on the tip of the finger when I was working with that baling twine out at our retreat about a week ago. Quite abrasive material, and had a small cut across that crease when I was tightening up the baling twine and doing knots up. At the time I treated it, field hygiene, some first aid, flushed it, put antiseptic on it, and away we went. So about 2 days ago I was doing something at home, and as with all wounds, you get the healing tissue, the scab on top of it, and I knocked the top off it. Obviously got something in it, and it's become reinfected again. You can see just probably to the right of the joint there, whereas under the skin there's a lot of yellowy green pus. So I'm going to have to get this lanced and see if it heals up. Otherwise it's a trip to the doctors for a course of antibiotics. So it's a case of, in the bush, a survival situation, homestead or even at home, even the smallest cut like this, never take it for granted that your first treatment is going to fix it. You've got to keep an eye on it, keep on the ball, and keep on top of it. It's so easy for it to become reinfected. Now, this has immobilised my finger a bit. It's quite sore to bend, not uncomfortably sore, but it's noticeable. It's red with infection, and it does inhibit some activities with my right hand, being a right-handed person. It's also my trigger finger. So something that keeps reminding me, never become complacent about the smallest cuts in the bush. I know from experience in the past that there are people get a small cut in the bush and they think they're a big sook or a wuss if they have to go and get a band-aid and get it treated and that sort of thing. That's a load of rubbish. It can become infected so quickly, and in severe cases your septicemia sets in, and you're in all sorts of trouble. So that's a lesson learnt by me again. I became complacent about this particular wound. I should have known better, and I do know better, but that's what happens when complacency sets in about even the smallest wounds, cuts and that sort of thing. So that's a lesson for me, and I hope it won't be a hard-learned lesson by other members on the forum. Keep on top of it, even if you have to immobilise it. Keep it clean, keep an eye on it, look for further signs of infection. So I have to get this lanced today and see how it goes over the next couple of days. Okay, thanks Dragon.